Dr. Hotchkiss, so blood donations. I know that we always constantly hear if you're on TRT or taking, anything over that as far as steroids, if you're competing, that you need to donate blood because it's going to increase the thickness of your blood taking outside hormones. Is that true? Something we should be concerned of? What's your take on it?
There's a lot of debate right now in the space of hormone optimization of TRT and even just like steroid talk about this. It's something that we know for sure that taking exogenous hormones will increase the production of red blood cells. And then we know that your hematocrit, or your percentage of blood that is red blood cells, increases. And so that does theoretically make your blood thicker. The idea then is that that will increase your risk of clotting, potentially strokes, things like that. We know that from other disorders like polycythemia vera, which these people produce more red blood cells, and that's a group of people that are more at risk of those disorders. However, that being said, there's other groups like people at high elevations who also produce more red blood cells, and we don't historically recommend that they just go kind of blindly give blood donations. There's tons of people that live in the mountains and stuff, and I'm sure those of you watching are like, yeah, I've never given a blood donation just because I live at a high elevation. So the arguments kind of come up that maybe guys on TRT aren't like those on, or those who have polycythemia vera. Maybe they're not as predisposed to those risks. I'm someone who I don't like to take the risk of just saying like, you're probably okay. And I feel like giving a blood donation is doing something good for humanity, right? Like, of the people who receive that blood need that blood. And so it's probably an okay thing to do every now and then. One caveat to that is that I don't like when clinics or doctors just kind of tell guys to blindly give blood donations. So sometimes they'll say, do it monthly, do it quarterly. Some guys don't have as robust of a response to the exogenous hormones, and they don't produce as many red blood cells as others do. So telling somebody to blindly give a blood donation can lead to an iron deficiency anemia, and those guys often feel worse after the blood donations than they did, before even getting on TRT. So you get guys coming to us who are like, I've been on TRT, I feel like absolute crap. We look at their lab work and they have an iron deficiency because they're giving blood once a month. So I would say blood donations are likely okay, and they're probably beneficial for numerous reasons. The biggest one being that you help other people, but also sometimes we do have iron overload and things, and we can feel a lot better if we get rid of some of that blood. But just don't do it blindly. Correlate that with your labs. When there's a need, give it. If there's not a need, maybe hold off.
Good. And is there any difference between hemoglobin and hematocrit? I know they're two different measurements. Is there any one that you should pay attention to, one versus the other?
Both are important for sure. I focus mainly on like the red blood cell count and the hematocrit. And I would, work with your doc too. It's important not to try to evaluate these things on your own. Definitely, if you're doing TRT, hopefully you have a good doc and you can kind of talk to them and look at all of your risk factors and see if, it is something that you need to do is give a donation.
Awesome. Thank you, sir.